How do doctors avoid misdiagnosing schizophrenia? Imagine trying to solve a puzzle where some pieces look alike but fit differently. That's what diagnosing schizophrenia can feel like for doctors. They need to be very careful to get it right. So, how do they do it? First, they look for a specific set of symptoms that last for at least 1 month and cause real trouble in daily life. These include hearing or seeing things that aren't there, holding false beliefs, or having trouble talking clearly. They also check for negative symptoms like feeling less motivated or showing less emotion. But they don't just look for these signs alone. Doctors also ask if these symptoms could be caused by other things. For example, some drugs or medications can cause hallucinations or confusion. They might order blood tests, urine tests, or brain scans to rule out medical issues like brain tumors or diseases such as Wilson's disease. Next, they consider other mental health conditions that can look like schizophrenia. Conditions like brief psychotic disorder last less than a month, while schizophreniform disorder lasts from 1 to 6 months. Schizoaffective disorder involves both psychotic symptoms and mood problems, like depression or mania. Bipolar disorder with psychotic features and severe depression with psychosis can also be mistaken for schizophrenia. Doctors also look at personality disorders, especially those that seem odd or eccentric, but these usually don't involve full psychotic episodes. The timeline of symptoms is very important. Schizophrenia requires symptoms to be present for at least 6 months, with at least 1 month of active symptoms. If symptoms come and go or last less than that, doctors might consider other diagnoses. They also review the person's history, including their age when symptoms started, family history of mental illness, and any previous episodes. Usually, schizophrenia begins in late adolescence or early adulthood, but not always. To make sure they are correct, doctors use structured interviews and assessment tools. These help them follow clear guidelines and ensure they consider all possible causes. By carefully checking symptoms, ruling out other causes, and following strict criteria, doctors greatly reduce the chances of misdiagnosing schizophrenia. This careful process helps ensure that people receive the right treatment for their specific condition.